Okay, next up we have Varun Goyal from Illuminate Health.
Thanks. Good afternoon. Uli and Brijesh, thanks for having us here today. Great event. My name is Varun Goyal. I'm co-founder and CEO of Illuminate Health. My entrepreneurial journey actually started a few years ago when my wife was pregnant with our first child. And we were fortunate enough to prevent a potential miscarriage that could have been caused by a medication error. And obviously that happened because something fell through the cracks, but it opened my eyes to the need for a truly clinically intelligent consumer tool that could have prevented something like this. And that's where my passion for Illuminate Health came in, and we founded this 2 years ago. And our mission is to be that digital care assistant for the consumer to help them take medications at home and provide the connectivity. Our focus is really on helping consumers and physicians and nurses optimize medication therapy. Medication compliance obviously is a causal factor relating to the $528 billion challenge, but it's also the consumer who does not know how and when to take the med, or they take a wrong dose, or they are taking a medication that interacts with another medication. And that's where, philosophically, we want to be that digital nurse, like in the hospital environment, who comes to your bedside, gives you the right med at the right time with the right dose, and the patient doesn't have to worry about it because at home, it's a mess, right? And Dr. Google, who all of you love so much, isn't cutting it. So that's where, we decided, given health literacy issues, the approach that was really needed was to start out by helping the consumers create a personalized medication schedule for them. And this is powered by our technology, where I hired a pharmacist from day one to help inform the rules and the algorithms behind this. And we personalize it to the patient's routine, because research has shown that compliance is going to be higher if you incorporate meds into their existing routine. So in a way, we like to think of ourselves as kind of going the extra mile of translating the doctor's orders into a patient-friendly format. So a couple of quick examples you see up here, for example, are, levothyroxine, which should be taken on an empty stomach. So we'll schedule it first thing in the morning, right? We've had so many cases where people were taking a diuretic before going to bed, and then obviously spoiling quality of sleep, waking up in the middle of the night to go to the bathroom. So those are the kinds of things that, we're providing better wellness and efficacy on. And as you can see from the user interface, we've utilized cognitive science-based principles to provide the right information at the right time, which is the instructions, the precautions, the pill ID, so the patient knows exactly which pill to pick out from the pill organizer. And obviously, safety is at the core of what we want to offer. And so just like a pharmacist, we run through automated proactive safety checks just so that when I go to, let's say, an urgent care and get a Cipro, but I'm on warfarin that my cardiologist may have prescribed, then something like that can be caught in time. We're all human, and we need that support when we're sick and we're recovering. And so that's where we knew that we needed to put that connectivity in the hands of the consumers as well. And there's a couple of different scenarios here where, as we talk to more and more patients and family caregivers, there was a need for helping the family care coordination piece too. So if you notice, I'm connected to my dad, who's a diabetic, so that I can help monitor his meds. I am also connected to my hospital, and we're also launching our own Ask a Pharmacist service to kind of offer that human element to the real-time piece here. To close the loop, of course, we're providing connectivity to the clinicians, because we definitely believe that we want to extend that relationship. We want to continue that patient-physician relationship outside the four walls of the hospital or the doctor's office. And that's where our tool can help be that bridge, either through our web portal or through the EMR interface. We've built our product as a platform. So on top of the medication foundation, now we're adding modules, building disease-specific modules where we want to inform the consumer about the what, when, and how. We did that for meds. Now we're doing things like, starting with substance use disorder patients, now it's time for you to do your daily spiritual reading. Click here to do so. Do your meditation. Look up an AA meeting. So taking that really holistic approach, and that's what's really exciting in terms of the scope of where we can take this next. we had some really good results with a pilot we did early last year with IU Health in Indiana. And we demonstrated that compared to the other health apps on the market, we were able to not only retain patients for as long as 45 days before they, transitioned off, but we were also able to have a higher degree of engagement. And with that, I'm happy to take questions.
So I guess two questions in one. Can you walk me through your business model and how you're going to make money, and then, what's your competitive moat versus the I think endless number of apps that are going after medication adherence?
Good question, and I think this is one of the older decks, maybe. But so let's talk about competition first, right? So we're definitely creating a new digital health category of a product. So there's tons of these point solutions on the market that you referenced. We saw that there was a need for a comprehensive solution, and that's where we took the time to build this out. And so that's part of our competitive advantage right there, apart from the truly automation and the clinical intelligence that we have in our platform, where we started out with an app, but the possibilities are endless, right? So we're already working on the next way of interacting with the patients, like the Alexa platform, and enabling our intelligence there. So in terms of business model, currently, so we did close out last year as revenue positive, which was nice. The hospital is the one that's paying for it. So we started out on the hospital side. We're starting to explore the payer and the self-insured employer route, because if you think about who's on the hook for the compliance, preventing adverse events, now with Pop Health and remote patient monitoring, that's where we're taking this.
What kind of IP do you have on this?
Great question. So we have a utility patent pending on the solution that you saw, which is how we put together that schedule. So the workflow we go through and the data model that goes behind it is the IP that we've filed patent on.
I'm sorry, maybe I missed this, but does this integrate with EMRs at all?
Yes, we late last year we got approval for the Smart on Fire to be able to pull the med lists, allergies, conditions from Cerner, Epic, and Allscripts, I believe. Yeah.
One quick question: does this integrate with the personal health record? Because I think this has great applications for medication reconciliation, which is a dreadful task for the physicians.
Yeah. So from that perspective, we started out with Apple Health, given they've got some really good traction with getting hospitals on board. Now Google's obviously getting into it, so we're going to explore that aspect as well. So that's how we're approaching it.
Thank you, Varun. Thank you so much.
Okay, thank you guys.
And thank you to Ava.